Session 2, Working with Galaxis, Part 1. This class focuses on the basic use of the Galaxis Galileus Viewer program. We'll look at adjusting your panoramic curve, overview of the workspace, including navigational tips, the 3D skull features, and some of the diagnostic tools. Once you have a 3D image acquired, it's in Sidexis. You can go from your practice management and launch into your patient's chart and then go into Sidexis to find your images, or you could go directly to your Sidexis icon on your desktop and open it from there. Once this opens, go to Select Image. If you have the patient's name, you'll see it at the top. If not, you'll be presented with the patient list. Select the patient you'd like to look at, and then you can see the images. As we talked about in the last class, by default, your Sidexis program is set up like this. If you're looking for your 3D images, it's easiest to click the 3D icon down at the bottom and go into the scan date that you're looking for. From here, you can sort into your list and pick any of the images that are 3D images. We're going to go ahead and open just this panoramic view. It doesn't matter what image you open as long as you see a 3D in the upper right hand corner indicating it is part of a 3D volume. You can click here. You could go up to your view menu and click here, or you can click your icon down here on the left to launch you into 3D. The time it takes to open into 3D is all dependent on your computer speed and your network speed. It looks to your control server or your RCU server to see if there's a license available and the status of that license. Most of the time you're going to be opening in viewer mode, and we can see that at the top title. If it says Implant Viewer, we know that we don't have a license automatically, and we can view and look at many things without the need of a license. We'll look into licenses and how to use that and how to acquire a license in a later class. Today's class is just on the basic usage and showing an overview of the windows. So now what we have when we open is what's called our workspace. These are the arrangement of the windows, and we have several different workspaces available. The one that opens by default is usually the panoramic, unless you change it and close the program in a workstation in a different view, and then that becomes your default screen for opening. If I go to Implant Align, if I've placed an implant, it will automatically center around the active implant in this window. MPR and radiology view allows you to view on many planes at the same time and do a full analysis of the scan very easily. If you have a different system, you may have different tabs down here along the bottom. With the Galileus Comfort Unit, you probably have a Ceph tab. We're going to go back to the panoramic view. Here in this view, I'm going to show you several of the tools and several of the ways that you can adjust the windows. Now, in our windows, we have these lines that separate, and when we hover over the lines, you can see that it creates this little tool. Left click and hold the mouse, and the tool will move. This tool allows you to change the size of your windows to customize it to a way that makes it easier for you to view, and whatever way you set this up is the way that will become the default at this workstation, so the next time you open it, it'll look that way in this workspace. Now, also on every workspace, we have a full screen view. This allows you with one click to open up and show the image in the big screen. To go back, just click the icon again, and it goes back to the smaller view again. To have the best possible viewing, Once we're in 3D, one of the first things we want to do is adjust the panoramic curve. You'll want to have that focal trough go completely on the image and right through the middle of the teeth. And if you see here, because of patient positioning, the focal trough is not anywhere near where we need to be. You can also see on the 3D scan where that focal trough rides. The horizontal plane should be level of the plane of where you're doing your implant planning, or if it's just a general scan, the occlusal plane. To adjust this, you'll go here in your diagnostics tools. This launches this window that allows you to pick a jaw shape, a jaw size, and the thickness of the focal trough. We can also rotate left or right, and we can go through slice by slice by using these arrows. I usually don't use these tools. I find that it's much easier to use the slice by slice here with these tools. Now you're taught right from the very beginning to go down to the notch of the mental foramen. Let's show you that method. We'll use this arrow down and bring ourselves all the way down until we start to see those notches. And you see there's one very clearly, and there's one on that side. When the person is tilted in this manner, sometimes it's a little difficult to find them both in the same plane. And so what you can do is kind of split the difference. So we'll go down, there's one notch, there's the other notch. Now that we see the notch here, we're going to go up just a little bit to start to see that one, and I'm going to split the difference here. Left click on the axial view allows you to take that full focal trough and put the blue line just on the outer edge of the bone. I look at the panoramic view and I can look at the way the teeth are. When I see it pull apart, as you see here, and you start to see this space, that shows me I've gone a little bit too far. Now again, this is all dependent on patient placement, and we find sometimes that image quality is all due to bad placement. If your staff is having problems trying to position a patient properly, there are some videos on the Sirona 3D site under the user login section that teaches them how to position a patient properly. Now, once I have my view, the blue line is our sharpest point in the scan. So now, as we start to come up through the scan, what we're looking for is to see the blue line now starts to go to the root tips. And as we go farther through, now you're starting to see that it might have gone outside of the view. So if I'm planning on this arch, I may want to come out just a little bit, or I may want to change the view to a smaller person if this is where I want to be looking. You'll learn as you work with your scans how to adjust this for your optimal viewing. Always remembering the blue line is your sharpest point. Everything within the yellow lines is our focal trough, and everything we want to view should be within that focal trough. We can turn if we need to, if we're going to go all the way up. And you see now what I was saying, that maybe the bottom arch is going to be on one plane, but your upper arch is going to be on another. Since this person has a stent plate for a CCAT classical guide, that's what we see here in the shadow, we know they're implant planning for the top arch. So let's go up a little bit more, and as we see, it's not quite there on the teeth. So let's bring it down. It may not be the best looking pan, but it will look better for our implant planning and allow us to get right to where we want to see, to have everything in the best view as possible. Once we look through the scan and we see everything we want to see is within those yellow lines, if it's not, We can make those lines a little bit bigger. We can go ahead and click OK. And now you'll see it's re-rendered the panoramic curve. We move the window. We can go along the focal trough. And if you're watching in the bottom on the axial view, you can see that you can go through and very plainly see the arcs that we're looking for. We can hold in the mouse and be able to go in or out of the views. Inside the windows, we also have the yellow lines. The yellow lines help you to have a reference point of where you are. I like to show people that the axial view is kind of like your road map. It allows you to see where you're at any given point very quickly. The line that goes here is your cross-section line. So this would be the plane that you see in this cross-section. The straight line you see, this is your tangential view. That would be the slice that you see here. The curve is your view that you see in your panoramic curve. The curve that the slicing window, the focal trough as we call it, and as you see, as I move it along, you can see how it will track. Now here, you'll notice if we go down, that we're way inside. That's why it looks kind of strange here. So inside this window, think of it as binoculars, that you have to left click and either go in or out to get yourself into a view to see what you want to see. You'll start to learn that you don't need to use this little slicing window by left clicking the top and rolling over, because you can just quickly go to any area you want to see by just double clicking on the area, and you can do that on any window. So if I want to look here or look here or even look over here, I can move very quickly without left clicking and rolling this back and forth over the panoramic curve. I find it saves time by just getting used to not using this view, but as you're starting to do the transition from looking at panos to working in a 3D world, some people are more comfortable. Panoramic curve gives you that full orientation, but then you train yourself to use the different windows and find yourself looking back and forth at several windows at the same time. We can use these slide bars down here to tilt the planes rather than being at right angles. This one, for example, we can use the little slide bar here and be able to tilt to go completely through the middle of the root and be able to see the area that we want to see in the tangential plane very clearly. Right-clicking on the image will allow you to move it and center it. If you go to the Diagnostics tab, in our tools, we have this brightness and contrast. I find that if you move your contrast up 10% or a little bit more, that sometimes it darkens your scans a little bit better for you to be able to see. Now once we've done this tilt, we can also just reset it back to the normal view. Now if we go to the back here, we can then look at those teeth and we can center ourselves a little bit better, right, by double clicking. So there you can see how we can turn it more and be able to see things we might not normally be able to see. Click on this little icon to reset it back to the default value. If we want to hide our crosshairs to be able to see even better, that's what these little boxes along the bottom do. These allow you to hide the crosshairs here. If I had findings or implants and abutments and sleeves, which we'll talk about in another class, you can hide those, and they're hidden when you see it's a dark blue. This is our acquire or request the implant license. If I want to bring them back, just click again and we're back. Other tools we have that will always be there is to allow you to use the pointer. This is what we have active. Use the hand tool that allows you with a left click to move your image around, any one of these images, to make it more centered for you. You also can achieve this by using a left click or a right click on your mouse will give you the hand tool. Enlarging, minimizing. Also, if you have the roller wheel in the middle, you can use that to enlarge or minimize. This tool here allows you to click on a plane and go step by step through the slices or up through the slices. Along the right-hand column, we have tools and tabs. These tabs each have a heading. This is the diagnostics tab, which we'll go over the tools individually here in just a few minutes. We have the findings tab, and you see as I click each one of these tabs, they pop to the top, revealing the tools available. Grayed out tools mean that you need to have the implant license in order to use those tools. CAD/CAM, implant planning, and to order surgical guides. If you have an implant in place, you could still print up a report form, but you couldn't order a guide without an implant license. In a later class, we'll go into the skills that all involve having a license. Some of the other tools that we have in the diagnostics tab, other than adjusting the panoramic curve, is to create a wrap and go viewer CD. This allows you to create a viewer disc for someone to view, just as we'll be showing in this class and in further classes, anything that does not require a license. We'll go into some tips about how to create these viewer CDs and how to help your people who receive those to use this program better. This is your measurement tool. Once a tool becomes active, it remains blue. Just as if we were to pick and hide anything down here at the bottom, that those would become blue also. Now, if I want to do a measurement, I hover over the windows. I have just pointer arrows because it's not possible to do measurements on a panoramic view or the 3D view. But if we come to these bottom windows, we can see that we have the crosshairs, which means that that is an active window that we could actually start to do a measurement. So we'll click once to set the tool and then drag the tool across to where we want to measure. It'll put a line along with the measurement. If we want to move that measurement, we can move it just by left clicking and moving the measurement. Or we could right click on it and remove the measurement. This is a multi-point measurement. It allows you to measure multiple points at the same time. So for example, we would want to measure at an angle. We can set multiple points to be able to put a measurement in there. Again, right click and remove. Now, if we want to measure angles, we can click this tool, come down to one of our planes. The first click that you do is your pivot point. Then you'd go click the next point, and then there's your angle. And whenever you stop, that creates the angle and puts it in place. Just like before, we can left click and actually move that angle to different places. However, you can't move it to another window pane. Right click and remove. This window is for Print Workspace. It allows you to quickly take the views and send them directly to the printer. Let's take a look at that. It brings it open, and then you pick the printer you want to use. You can go into the properties and set your landscape, letter, whatever the properties are for your computer would open. In quality, I tell people to go to either general or fast draft so that you use less ink. We'll talk about printing a little bit more in future classes, but normally before you print, usually you want to use the tool of Print Preview so you know what you're going to get before you waste ink and paper. This tool allows you to look at grayscale. This is not Hounsfield measurement, this is relative grayscale. And again, if I go over the top windows, it's not active, but it becomes active when we see the X. We can left click and it makes a circle. This is telling us the measurement in grays. And as we move from the lighter to the darker, we see the numbers. And we can hover over different areas and look at relative density based on grayscale. If we release it, it's no longer available. We'd have to go back, click it again, and then go to a different window. And you see, you can't go to another window to use that tool. We can look at some other tabs. The Implant Align, we'll look at that a little bit closer in a later class. MPR View, you can see here that we're able to go full screen view. We have all the same tools at the right, and we have slide bars. It's nice because you have the active slices in your 3D view. As I select each window, you'll see that it becomes orange in your 3D view, indicating that this is what you're looking at. So here, let's look at our slide bars. If I tip, you'll see on my 3D view, that's the plane that we're looking at in the sagittal or oblique view. Again, click on the little icon at the bottom and it resets it back to default. The same here. If I want to turn it this direction, you'll see that the view changes here, allowing us to see it at a different angle than what we would normally be able to see. And all I'm doing is left clicking and rolling this 3D view around. Click the icon and it resets it back to the normal view. Now, one other thing that we could do within this 3D view, which we'll look at this a little bit closer in a later class, but one of the easier things is to quickly, with these little arrows, to change our views just by clicking those, and you don't have to grab a hold and roll it around. Same thing down here. This gives you the orientation of where that is. You'd do the same thing here. And just like before, all of the same icons down here work in every window the same as they did as I showed you in the panoramic view at the beginning. Thank you for viewing our Sirona Support webinars. Here are some helpful sites for further training.